And I'm going to read my patient notes.
you're allergic to penicillin. Okay, so when you get the penicillin, what you develop, like any kind of reaction, or you had a rash? Okay, I can see here as well. Okay, so I have already confirmed all the details with you, but before we proceed, I just want to do the pain score assessment. Is that okay if I will do that? Yes, sure. Okay, so where
Okay.
is the pain particularly? It's in the right chest. So it's in the right chest. Okay. So
Hello, Elizabeth. I'm the nurse that's looking after you this shift. How are you feeling?
I'm good. I'm a little bit in pain.
You're a little bit in pain?
Yeah.
How long have you had this pain for?
About a couple of hours.
Do you mind if I ask you, from a scale of 0 being not so painful and 10 being really painful, what would you rate it?
Yeah, I would say it's about 8.
8? And where is your pain?
It's in my lower abdominal.
Your lower right abdominal?
Yeah.
Okay, and does the pain radiate?
No, it doesn't.
No? Okay. So we're actually due for some pain medication, which is endone. I'm
Yep.
going to go prepare everything, and before I do, I'm just going to need you to tell me your full name and your date of birth.
Yes, mate.
So your full name, please?
It's Peter Pitt.
Peter Pitt. Peter
First
Pitt.
of 1st, 1945.
1st of 1st, 1945. 1st of 1st, 1945. And your MRN is 123754. 123754. And are you allergic to anything?
Yeah, penicillin.
Penicillin?
I got
And
rash all everywhere.
You got a rash?
Mhm.
Okay, alright, we'll take that into consideration. You're not having any penicillin, so we'll be okay. So I'll go prepare everything and I'll be back.
Yep.
Okay.
Yes, mate.
Okay. I'm just going to validate this medication order. We've got the right patient, Peter Pitt, his date of birth 1st of 1st, 1945, his MRN 123754. All of this has been confirmed with the patient and his ID ban. He's allergic to penicillin, he gets a rash, and this is signed and printed by the doctor, and this is also verified with his ID ban. It's red. We've got the correct date, 2018, the 5th of the 3rd. Down here we've got the date. It's to be given orally. It's for his pain. We're giving him oxycodone, 7.5 milligrams, to be given twice a day. It's due now, and it's signed and printed by the doctor. It hasn't been given yet. This makes it a valid order. Also have to assess the vital signs of the patient to make sure they're within flags. We've assessed that, so we're good to give endone. According to MIMS, endone is a narcotic analgesic. It's used for pain. Contraindications include acute respiratory depression, cardiac arrhythmias, bronchial asthma, and adverse reactions are GI upset, constipation, and hypertension or drowsiness. And this dose is to be given 5 milligrams every 6 hours. Okay, so now we're at the dangerous drug cupboard, so we're going to wash our hands for infection control.
Yeah.
So, grab the drug book, medication, anything we may need to prepare ourselves. We'll close this, but we're not going to lock it because we're not moving. So let's make sure that we have the right page. Okay, so do you want to check with me?
Yep.
So we have endone 5 milligram tablets, endone 5 milligram, and the expiry date is December 2020, so it's good to use. There are 20 here, so we're going to count that there are 20. We can do that now. Okay, so there are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Do you agree?
Yeah.
Good. Okay, so we'll leave this aside and we're going to do my first drug check. Okay, so we've got the right patient, Peter Pitt. We've confirmed his date of birth, his MRN, and he's allergic to penicillin. Both of these details have been verified with his ID ban and with the patient. We've got the right date, 2018, the 5th of the 3rd. We've also got the right date here. We've got a route orally. The medication is oxycodone, which is also known as endone. We're giving 7.5 milligrams. This has 5 milligrams to be given twice a day. It's due now, it hasn't been given yet. It's for his pain, it's signed and printed, and the expiry date is December 2020. So that's my first drug check. Now we're going to do the maths, calculate how much we need. So $7.5 over 5 milligrams gives you 1.5 tablets. Do you agree?
Yep, agree.
Okay. So now that the maths is done, we'll just get the medication out now. Okay. So where's my little? So we're gonna grab 1.5.
So now I'm going to wash my hands because I'm going to use the cover to dispense the medication.
Oh my goodness, sorry.
So we need
So there's one. We can put one here because we have to cut half. So I'm not touching this. So we'll just grab one here. I'm gonna grab gloves and do this. Up here. So the one that we're going to discard, we'll just leave it there. And we've got one here, and then we've got one tablet here. So that's 1.5. So we'll leave that to the side. So we've got the correct patient, Peter Pitt. His date of birth and his MRN have been confirmed with the patient. He's allergic to penicillin. He gets a rash. If he has penicillin, it is signed and printed by the doctor. Both of these have been verified with the patient, his ID band, and himself. We've got the right date, 2018, the 5th of the 3rd. Right date, we've got a route. Orally, the medication is oxycodone, also known as endone. His dose required is 7.5 milligrams. We've got 5 milligrams. It's to be given twice a day. It's due now. It hasn't been given yet. It's for his pain. It's signed and printed by the doctor. The expiry date is December 2020. And with the calculations that we've both agreed on, we're going to give 1.5 tablets. Okay? So now we're going to and we're going to dispense the other half. So I'm going to dispense that half, close this. After the calculation, we're just going to count how many we're going to be putting back. So we'll count together. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18.
Yep.
So we're happy to put 18 back.
So root is per oral, dose is 7.5 milligram. We're going to calculate that later because we are using 5 milligram tablets. So frequency is BD is for PV.
Okay, so now we're just going to do the third drug check before we give this back to Peter. So we've got the right patient, Peter Pitt, his date of birth, 1st of the 1st, 1945, MRN is 123754. He's allergic to penicillin. He gets a rash if he has penicillin. It is signed and printed by the doctor. Both of these details have confirmed that it's the right patient. Right date, we've got 2018, the 5th of the 3rd. We've got the right date here. We've got right medication, oxycodone, also known as endone. To be given orally. The dose is 7.5 milligrams. We've got 5 milligrams. It's to be given twice a day. It's due now. It hasn't been given yet. It's for his pain, signed and printed by the doctor, and the expiry date is December 2020. And we've got 1.5 tablets that we're going to give to him.
Yep.
So all drug checks are done. Okay, so now we're just going to fill out the drug book. So today's the 5th and the 3rd of the 18th. It is
So I'm going to my patient.
0750. Patient's name is Peter Pitt. Amount given is 1.5 tablets. Described 0.5. Balance is 18. Name of prescriber is Peter Brown.
Could you please tell me your name? Peter Pitt.
I am giving him.
And date of birth? 1/5/1945. 1/5/1945. And MRI is 1.
And can you please co-sign with me?
Yeah, sure. No problem.
Okay. Mr. Pitt, can you please state again what kind of allergies do you have? Penicillin. What happened last time? Rash. Okay. So all the details are correct, Mr. Pitt?
Okay, now that we've got this drug book checked, we're just going to put everything back.
So this tablet before giving it, I just need to inform you this tablet can cause gastric irritation, constipation, and irritation as well. So I just need
Okay,
to
so now we're going to head over to the patient with the medication.
check your
So, back at the bedside. Okay, hi Peter. I've got your pain medication, Endo. Just before I give it back to you, can I please confirm your name again?
Yeah.
Your name, please.
Peter Pitt.
Peter Pitt.
First of first, 1945.
First of first, 1945. First of first, 1945. And MRN is 123-754. 123-754. And what will be allergic to?
Penicillin.
Penicillin. And you get a rash when you have penicillin? Yeah. Okay, so I'm just gonna sit you up, but because the bed's not working, we'll sit you up, and I would have a glass of water, and here is your endone. Takes the endone. So I will be back to check up on you in 15 minutes. I'm going to check your vital signs and your pain again. And if you feel any upsetness in the tummy or you feel nausea, just buzz me. I'm going to leave the buzzer here, and I'll be back to check up on you in 15 minutes. Okay?
Yeah, okay.
All right. I hope you feel better.
Thanks.
I'm just going to discard the medication. And I'm going to fill out my medication chart.
Yeah.
So, and can you please co-sign? Okay. And I have now concluded my Vacs.